Would you ever recommend hypnotherapy to somebody?
So let's focus on non-organic,
Okay.
that central sensitization, which I personally believe patients who have had chronic pain, so chronic pain is defined as pain that lasts for more than 3 months.
Yeah.
But I think if they've had pain that lasts for more than 6 months to a year, I actually personally believe the majority of those patients will have some element, whether it's 1% or 99%, but some element of that inorganic pain, that central sensitization. Their brain chemistry has changed, and we have functional MRI data to support that theory. So how do you change that? It's going to take a lot more than an injection or a surgery or a medication to change that, and that's where you have to focus on things that change the brain chemistry.
And what have you seen that works to do that?
So a couple things. So one thing that we have done on our own that we're able to provide for patients is something called a ketamine infusion.
Okay.
And what that is an infusion, a long-duration infusion of a medication called ketamine. And ketamine's been around for about 50 years. It's FDA approved. It's used all the time in operating rooms all over the world. It's actually a pretty amazing medication. Unfortunately, again, going back to this whole pendulum swinging thing, you have some really dumb people who've done some really dumb stuff with legitimate compounds. And so people will say, ketamine, I heard that it's used on the street, or I heard that's used in dogs and veterinary care. And of course, it's a medication just like any other medication, but it's a very unique medication. It binds to a receptor called the NMDA receptor, the N-methyl D-aspartate receptor. And that receptor has been implicated in this whole hyperalgesia wind-up phenomenon, this cascade of pain. So when that receptor gets bound to and it doesn't get unbound, it releases some excitatory compounds called glutamate and glycine. Those excitatory compounds then cause this positive feedback loop. The more pain you have, the more they get released, which means you feel more pain, which means they get released more, and it just keeps going. It's called... Some people call it the wind-up phenomenon.
So ketamine stops the wind-up phenomenon?
So we found that with these infusions, it has literally, on the spot, at the end of the infusion, we've had patients who have left there completely symptom-free, and that effect has lasted for weeks or months at a time. And that drug is metabolized so fast, usually the half-life is usually a few hours, a couple hours. So within a day, that drug is pretty much out of your system.
Wow.
So it's not the drug that's causing that, it is literally resetting those receptors.
So it Control-Alt-Deletes the pain receptors.
Exactly.
Fabulous.
Control-Alt-Delete for the brain. That's exactly the term I use for the patients.
Really? Okay.
That's exactly the term.
Okay.
And it reboots the receptors that are causing these hyperalgesic conditions. So I'll name some of these conditions. Some of the conditions like CRPS or RSD, which we talked about, complex regional pain syndrome, but other terms that people are more familiar with, like fibromyalgia or depression, anxiety.
Wow.
PTSD, post-traumatic stress disorder.
The ketamine is helpful for all of these things?
We've seen people literally be symptom-free right after the infusion and lasting for weeks or months at a time.
Wow.
Because if we look at the science behind it, it totally makes sense, right? If the science is telling us, and the science is complicated, I don't think there's anyone who truly understands every little step. But what we do know is we know there's certain parts of the brain that are hyperactive, and those parts of the brain are hyperactive because those receptors are being modulated excessively. So if we can Control-Alt-Delete that receptor, we should see the operating system boot up normally.
Yes.
If you leave that computer on for a while, it starts getting slow again.
You have to take care of the operating system.
You have to take care of the operating system.
Right. So if you Control-Alt-Delete it and then people go back to they revert back to their, biggie fries or whatever, all the choices that cause the anxiety, the depression, and we know what those choices are, people. The choices that aren't exactly feeding our mind, body, spirit, the wellness, so to speak.